I think last but not least, we are going to talk about the physical comorbidity in psychotic disorder. As you know, it's a major problem in our patient, and especially obesity, weight gain, metabolic syndrome. These are the major issues that we are dealing with in relation to physical health. And we were very fortunate to have Aldanie Rho, who is working in our program. Aldanie, by her training as a physician, is very interested in these questions. She's the one who keeps us on track every Monday to tell us who is the patient who didn't have his specific and follow-up in terms of physical health. And she's going to present on addressing physical issue, health issue in early psychosis. Aldanie.
Thank you. Just a little background. I remember when I came here for the interview, for the job interview, they were looking for a nurse, but you know, I'm trained as a physician, but I was saying, I'll still present myself. And gladly enough, and you know, I'm really glad to be part of that team that they hired me. And since then, I've been working, you know, on physical health issues, trying to track down patients, their weight, their waist circumference, lipid profile, and everything. And that had been a big struggle, sometimes with the clinician. But fortunately enough, as you will see with the results, things have worked pretty great so far. So, first of all, I would like to say that usually, you know, we're dealing with people who are mentally challenged, and as clinicians, we used to put mental lenses to look at them, and we often overlook, you know, their physical health, and it is, you know, strikingly amazing to see that, you know, over a period of 3 months or 1 year, they can, you know, gain weight, and most of that weight will be around the waistline, and we need to, you know, intervene when we see that, as it is so obvious. And just a background about those metabolic disturbances, either weight gain, obesity, lipid abnormality, dyslipidemia, so on and so forth, they're pretty much linked to the use of the antipsychotic medication, because the antipsychotic medication is the only, as we can consider, this is the only add-on, you know, to the whole context. So they're pretty much linked to the occurrence of these metabolic disorders. But also when we look beyond, you know, those antipsychotic, we can also consider lifestyle factors. Imagine, for example, like a 16-year-old, you know, what will be their usual behavior? Once a week, they have to go to those fast food chains. I won't name any of them, but, you know, this is their kind of normality, you know, to mix in within their, you know, 16-year-old group. And also, you know, for example, it will be like every Saturday they spend the whole afternoon video games, internet, and they won't do nothing. They won't even, you know, grab anything that is, you know, what is not within their reach. So you can imagine what is the lifestyle of those young adults. I won't generalize saying that this is, you know, most of them are being like that, but we all know that quite a few behave like that. So there are also those lifestyle factors and also other predisposing factors. Studies have demonstrated that there are in the general population some genes that are associated with increased weight gain, just to name a few: FTO, fat mass obesity gene, and also BDNF. Numerous studies have associated them with predisposing factor, with obesity, with the occurrence of obesity. And also, as we all know, the obesogenic environment, this is kind of the new term. All of you can see, for example, from the place that you live, I mean, consider that within walking distance, how many of those, you know, fast food chains that you can bump into, for example. You can all do that possibly, you know, on a Saturday afternoon, but to see how close they are, for example, from your place of residence. And, I mean, it's important to see that, I mean, most of them, they're being within walking distance, sometimes within 10 or 15 walking distance. And imagine for a young adult, you know, the fact that, you know, those kind of, you know, fast food chains, and we know what kind of nutrition that they deliver, how that could intervene with the fact of using, you know, antipsychotic medication and all those predisposing factors. So therefore, those metabolic disturbances, they're, you know, they have a significant contribution to the health burden because they can impact, those young individuals' life, causing eventually, stigma because now they're being overweight and psychological distress as the same time that they're dealing, with this new thing, I had psychosis, I've had psychosis symptoms, and now they have to deal with another thing, being, those metabolic disturbances. And as you all know, despite that this issue is pretty complex, but also multiple intervention can be put in place to prevent and eventually, promptly address this issue as they occur. Here I'm showing you a pretty nice figure in a Stahl article showing like the metabolic highway. Like, we could relate that to, some of the Montreal highways with all the pylons. And as you see, people, as they're taking antipsychotic, they start being obese, and then they start having those glucose abnormalities, those lipid abnormalities, and then, so on and so forth. They're on the highway to have all the metabolic syndromes. So this is a pretty nice figure. And at the end of the road, you see that, those cardiovascular risk factors, as they occur, they can lead to premature death and eventually loss of about 20 years of normal lifespan. So this is a pretty, striking phenomenon that needs to be properly addressed. And when we consider all the different type of antipsychotic, there's a general consensus that, they are not all the same in their effects. There's some of them that are more likely to cause weight gain and more likely to cause dyslipidemia and so on and so forth. So here at pepp-montreal, this is what we do, in general terms. So regular monitoring is a must, and it's a real must, to really regularly monitoring those patients, sometimes at each visit. So for baseline, we encourage, to have all the clinical and also laboratory measures from weight, waist circumference. I usually put waist circumference in bold every time I do a presentation about, those metabolic abnormalities, because usually this is the least, as we will see also in some results, this is the least measured clinical measure. So therefore, there are different factors that can impede, clinician from taking it. So it is important, as antipsychotic, usually they have a tendency of causing, increased weight, and that weight is mostly, intra-abdominal, causing this increased waist circumference. So therefore, it is important to take the waist circumference. We also do some blood tests at baseline, and we repeat them every 3 months. For example, considering the lipid panel, the fasting glucose, and the endocrine, we repeat them every 3 months during the first year, and every 6 months during the second year. This is kind of, the major guidelines, but for specific cases, if there needed be, then we will adjust, for example. So we will look now at data, exploring what is the occurrence of those metabolic changes in first episode psychosis population, the pepp-montreal, and we will see from patient that, from the first patient that were enrolled at PEP until, the last patient that completed his 2 years March of this year, we would look at changes that have occurred in their weight and also the metabolic parameters over the course of the follow-up. Just a reminder, at PEP, the services are for 2 years, so we'll look at all the changes that have occurred during a 2-year period. So just a little bit of background on these subjects. Their mean age was 22 years, 69% were male, and 191 of those 262 had a diagnosis of schizophrenia spectrum. The others were mainly affective psychosis. So overall, we have observed a 10-kilogram increase in weight during the first year. This is kind of a lot, and a 4-point increase in BMI. And when we see what are the changes after the first year, we see that the values remain stable during the second year. So therefore, the critical period that we should consider now should be the first year, because this is the time period when we see that they have, this increase, this high increase in their weight. So just about the results, so the mean weight at baseline was 62. And at 1 year, it had increased to 78, and then at 2 years, it was still 78.24. And when we considered the BMI, so it was 22 in the normal range at baseline, whereas at 1 year, it was already 26, and it falls into the overweight range. And still at 2 years, it was 26.27, so still in the overweight range. So this is a graphic showing you the mean increase in weight, but when we consider gender during the PEP follow-up. So at baseline, the blue one are all patients, male and female. And in green, we have the female, and in red, we have the male. The results were statistically significant when we consider the difference in weight gain comparing male and female. So as you can see, female have shown greater increase in their weight compared to their male counterparts. So I didn't show the numbers, but they are like from baseline, male were 72, and then at 2 years they were 79, and then for female they were 58 at baseline, and they were 70 at month 24. And then when we consider also, the increase in mean weight in kilograms, as we categorize, all the sample based on the BMI at baseline, the literature have mentioned that people who had low BMI have a more high-speed increase in weight gain compared to others that have normal BMI or overweight or obese. And this is consistent with our results. As you can see, from baseline to month 3, those in blue who are considered underweight, they had a BMI in the underweight range, that means less than 18. So they are the ones who have shown the major increase in weight during the first 3 months. There's a trend that we see at month 6, but after all, everybody had increase in weight. And when we consider the results, when we look at the results also, we have seen that at 1 year, 33% of our sample did not experience significant weight gain, so that means less than 7%, whereas 41% have observed, moderate change. That means their weight have increased by 7 up to 20%. And then 24%, have had severe weight increase, more than 20%. And as we consider the type of antipsychotic that they were taking, when we classify the antipsychotic in 3 groups, those who have low metabolic profile, we can name a few, for example, aripiprazole, moderate, we can put in the moderate class, for example, risperidone, or even quetiapine, and high, those 2 that we name, clozapine and olanzapine. We have seen that those who are taking low metabolic profile antipsychotic, they still gain weight. I mean, it's not that with low metabolic profile antipsychotic that they're not gaining weight. They still gain weight, and here we see that they gain about 6.88 kilograms over the course of their 2-year follow-up, compared with those who are taking high metabolic profile antipsychotic who gain about 10 kilos. So here we see the graphic showing the increase in mean weight in kilograms during the first year. There was a trend that, as we see, for those who were taking moderate metabolic profile antipsychotic compared to the 2 others, and also at the following time points, we did not find any statistically significant results. And also the other point that is very important, it's not only to know that those guidelines, they exist. We need to monitor our patient to kind of assess if they have those metabolic abnormalities, but also we need to monitor, that whole process. And as we've seen, from monitoring that whole process, we've seen that, at baseline, it is more likely to have those results being readily available. We could explain that by the fact that, if about 50 to 60% of those who are entering into a first episode psychosis program, they come from being hospitalized. So therefore, it is more likely to have those data compared to, others who are entering, the first episode psychosis program from being outpatient. So therefore, we have seen that 80% of our sample, we have baseline data. And as years go by, it is less likely to have it. Possibly this could be explained by disengagement. People are not being followed, they do not come. And also, they're not being, monitored, especially at time of crisis. We can understand that. But it is important just to remind that it is really important to monitor for these metabolic parameters as they occur during the follow-up. So I'm just stating here a word from Jamie Curtis in one of her papers called The Heart of the Metabolic Issues, saying that, I can let you read it. Mainly she is saying that, we know that those metabolic abnormalities, that they will occur due to the fact that they're taking antipsychotic medication. Therefore, not only do we need to screen, but we need to intervene. Okay, so continuing on, about those metabolic issues, I would like to mention, the great work that we have done at PEP. We know that they occur, but mainly there were, important interventions that were put in place. Just to name a few, for example, I will mention about, the Douglas Minds the Body intervention. This is encouraging patients to participate into, community running events, like, for example, the Oasis Marathon. And this has been going on since 3 years with the leadership of Dr. Joubert. And we still, want to encourage our clients to participate into a running event. And also at the bottom, you can see a garden. This is an activity that we have done with the Cultural Society of Verdun. They give us one of those community gardens that you see around the hospital, and we had encouraged patients to participate, especially during summertime, to participate into gardening activities. And this is what we have done in 2012. And as you see, the food and nutrition. We have a nutritionist who is also working at our program, and she offers nutrition counseling, and also she organizes nutrition workshops twice a month, or even once a month, encouraging patients to have more to introduce diet changes, and also to give them literacy about food and nutrition. I would like also to mention, the important collaboration that we have had with the YMCA of Quebec. This is an intervention under the leadership of Sherazade Abadi and also Eric Villeneuve, two of our colleagues. And they have, established a collaboration with the YMCA. So then, our clients can readily have access to the services at the YMCA, and there they will have services to encourage them to do physical activity. So overall, we know that regular cardiometabolic monitoring is needed, not only to screen the patient, but also to prevent the occurrence of those metabolic abnormalities. And when we intervene, we can either do behavioral modification intervention, like the lifestyle, the diet, and also pharmacological intervention. I will not go into the pharmacological intervention, as this is more second line. So overall, I would say that the physical health of young individuals with psychosis is often overlooked, in mental health care. And treatment team, psychiatrist, therapist, case manager, everyone should, diligently monitor patients as they're receiving antipsychotic therapy. We just need to have the proper tools, and the proper tools, just a weight scale, ruban métrique. How do you say ruban métrique in English? A measuring tape, thank you. A measuring tape, and then also a blood pressure cuff. I don't think that's pretty much extensive or expensive to have. So we just need to have the proper tools and also the proper time. From meeting patient and also assessing all those clinical measures, I've understood that, it doesn't take you more than, let's say at most 7 minutes to have those measures, to measure those clinical parameters, and also regular monitoring, especially when it comes to blood work. So therefore, considering all those issues, an early framework, intervention is needed when we are considering those cardiometabolic complications, especially in young individuals. As I've said before, looking at the stall graphic, those cardiometabolic, risk factors, they can cause, 20-year loss of life and early premature death. So therefore, it is, strikingly important to intervene, early for those cardiometabolic complications. Thank you.
Thanks a lot, Aldanie, for this clear presentation. So questions? Yeah, we have one question here.
I would like to know, since you had the partnership with YMCA, did you notice any difference in the weight gain or?
We haven't looked yet at the results from participants that have been enrolled at the YMCA program. So yet we cannot provide a suitable answer to your question.
Okay.
But we're still encouraging our clients to enroll into the YMCA program. Thank you.
Any other questions? I think also from a public health point of view, it would be very important to connect with our colleagues, GPs, and to really give privileged interest to the system for this population at risk for their physical health problems if we want to do prevention on the long run.